Hi, I'm Carlin Koch and I'm a student nurse. I'm going to present to you a patient. Patient is an 18-year-old Caucasian single male. Patient is a senior at San Marino High School in San Marino, California. Patient's vital signs are stable. Blood pressure, 120/78. Heart rate, 65 beats per minute. Respirations, 14 breaths per minute. And temperature, 98.4 degrees Fahrenheit, taken orally. Patient's chief complaint is persistent migraines. History of illness. Patient reports that his migraines started 4 months ago and occur once to twice a week. Patient states that these migraines start as a severe headache with pain, typically an 8 out of 10. These headaches lead to blurry vision and dizziness. The pain is located in the right and left temporal regions of the head and lasts for about 2 hours. Patient reports to seeing flashes of lights and experiencing lightheadedness. The patient is alleviated when patient takes ibuprofen, when patient lies in a dark, quiet room, and when patient places a cold washcloth over his forehead. The pain and dizziness worsens when patient is exposed to bright light, noise, and when he is reading. Patient's migraines have caused him to miss several basketball practices and have caused him to leave school early twice due to throbbing head pain and extreme dizziness. Patient reports insomnia when experiencing migraines, causing him to lose approximately 2 to 3 hours of sleep per night. Patient perceives the migraine pain as throbbing and irritating. Health history. Past medical history includes shingles, diagnosed at age 12, and strep throat, diagnosed last year at age 17. Patient was treated for shingles with antiviral medication. Patient has not had a reoccurrence of shingles. Patient was treated for strep throat last year with 250 milligrams of penicillin taken orally 3 times a day. All immunizations are up to date. Patient has no known medical or seasonal allergies. Patient has never been hospitalized or has had surgery. Patient takes 200 milligram tablets of ibuprofen every 4 to 6 hours when experiencing migraines. Functional assessment, health habits. Patient denies consumption of alcohol, tobacco, and illicit drug use. Patient reports intense levels of exercise 6 days a week for approximately 2 to 3 hours a day. Patient reports regular sleep patterns of 7 to 8 hours a night, except when he experiences migraines. When migraines occur, patient's sleep is reduced to 5 to 6 hours a night. Patient reports a healthy, well-balanced diet with a heavy load of protein and vegetables. Patient rarely consumes coffee, approximately 2 cups per month. Patient reports annual visits to his doctor for routine checkup and visits to the dentist twice a year. Patient reports the use of safety devices, such as the use of a seatbelt when driving. Psychosocial data. Patient lives at home in San Marino, California. Patient has 2 brothers, a sister, and a mother and father who are married. Patient has no family issues and is not involved in any romantic relationship. Patient reports that he is supported by many close friends and relatives. Patient reports happiness and no signs of sadness or depression. Patient reports a high level of stress at school due to applying to colleges and maintaining good grades while playing on his school basketball team. Patient has reported recent acne due to his high level of stress. Coping methods include relaxing at home on the weekends, walking his dog, and watching sports with his friends. Patient identifies himself as Catholic and attends church regularly. He denies any environmental hazards at school or at home. Family history. Patient's paternal grandfather passed away from Parkinson's disease 5 years ago at age 86. Patient's maternal grandmother passed away 2 years ago at age 78 of Alzheimer's disease, which she had for approximately 3 years. Patient's maternal grandfather passed away 17 years ago of a heart attack at age 65. Patient's paternal grandmother is alive at 91 and has melanoma skin cancer in both legs, which has been persistent for 15 years. Patient's aunt was diagnosed with type 2 breast cancer 2 years ago at age 55, but is now cancer-free. Patient's other aunt passed away last year from type 4 breast cancer, with tumors spreading to abdominal organs. Father has a history of knee problems, including a torn ACL. Patient has no family history of migraines. Patient describes himself in great health. Physical assessment. Due to my patient's severe head pain, I have chosen to perform a neurological assessment. In addition, I have chosen to perform an integumentary system assessment due to his report of recent acne. Neurological review of systems. Patient reports altered gait and balance due to his migraine episodes. Patient reports no difficulties with speech and no history of head injury. Patient denies numbness, tingling, and burning and denies loss of consciousness. Patient also denies memory loss and denies decreased strength. Patient reports high levels of anxiety and stress. Patient reports no past history of migraines prior to 4 months ago and no family history of migraines or headaches. Patient reports no difficulty swallowing or speaking. Patient reports physical contact daily when playing basketball. Patient played basketball all 4 years in high school and reports it as a sport with physical contact and high risk of head injury. Patient played football for 2 years of high school, which he reports as another sport with high risk of head injury. Physical assessment for neurological system. Patient scored a 30 out of 30 on the mini mental exam. Patient was alert during the exam. Patient's gait was smooth and coordinated, and he was able to walk heel to toe. Patient was able to complete the Romberg test with no loss of balance. Patient was able to touch his finger to his nose, touch my finger, then his nose, and perform normal rapid alternating movement with his hands. Patient demonstrated normal lower extremity motor function and was able to touch his heel to his shin. Sensory function. Patient was able to perceive light, touch sensation, and painful sensation, as well as vibratory sensation. Patient demonstrated stereognosis, graphesthesia, and proprioception. Patient's plantar reflex showed no signs of Babinski response, and patient showed no signs of ankylosing. Integumentary review of systems. Patient states that he experiences acne when stressed, and typically when he experiences migraines. Patient denies extreme skin dryness and reports that acne is relatively new. Patient reports that his acne appeared when his migraines began, about 4 months ago. Patient's acne is primarily located around the chin and has worsened. Patient reports that he has tried different facial washes, but nothing has alleviated the acne. It worsens when he is most stressed. He reports that his acne does not interfere with any daily activities. Symptoms include skin redness and tenderness around the chin area. Integumentary physical assessment. Patient has no flaking or lesions on the scalp. Patient has a normal amount of blonde hair that is well distributed and has a normal texture. Patient's skin is clean, has good perspiration, and has no body odor. Patient's skin color is pale, which is usual for him, and he has normal skin tone and pigmentation except in the chin area. His chin has blotches of red with pimples. Patient's skin is moist, soft, normal thickness, and he has no skin lesions or scars. His skin turgor is normal, and he has no edema. Patient has good hygiene, and his nails are a normal color. Patient's capillary refill is less than 2 seconds, and his nails are attached, are normal shape, and have normal contour and thickness. According to an article published by Duke Graduate Medical School titled Program in Neuroscience and Behavioral Disorders, migraine auras are typically visual in nature but can manifest as disturbances in somatosensory, auditory, and olfactory senses. The theories of cortical spreading depression, cortical sensitization, and thalamocortical network involvement were discussed as possible explanations for sensory auras and migraine. Because of this, it would be appropriate to perform a head, ears, eyes, nose, and throat examination on my patient to test for somatosensory, auditory, and olfactory impairments. According to UBMD Department of Orthopedics and Sports Medicine, athletes involved in physical sports, like basketball, may experience concussions and have post-concussion syndrome. Some athletes with post-concussion syndrome have exercise intolerance that may result from altered control of cerebral blood flow. This is a possibility for my patient because he's involved in physical sports that may have caused a concussion and may have led to his migraines. Because of this possibility, it would be appropriate to perform a cardiac assessment on my patient to assess his blood flow.